I'm Suzanne Nichols, and I was diagnosed with insulin resistance about 15 years ago. And they told me that I had plenty of time, but if I didn't change my way of eating, it could lead to diabetes. A year ago, my doctor told me that I was 1 point from diabetes, and it scared me to death. And I thought I had to do something, but I was afraid of myself because I always sabotaged myself. So I started praying about it and asking for a coach, someone that could put me on a good diet that I would stay on for a lifetime, and to figure out what all my problems were that my doctors couldn't figure out. I found in the register that Sunday an ad advertising that we come to a meeting and we would learn every question I'd been asking about diabetes. And so I attended that meeting and met Dr. King, who presented himself in a very forthright way and very sincere, and told us that we were in a program where we would have to make a commitment, and he would help us get through that. I felt that he was the person that I would want to train me, so I joined for the 3-month program. One thing I liked about Dr. King was that he was very sincere about doing everything he put his patients through. If he ate something and wanted us to eat it, he made sure that he participated too. Even in the exercise equipment, he would do all that also. We never had to do anything that he hadn't gone through first, and I really liked that. And then he put us through a lot of tests to see where we were coming from, what needed help, and explained it to us in full so we could see just how serious the disease could get if we let it go any further. I was very excited. For the first time, everything seemed so clear to me. And he was very encouraging. He lifted us up. Even if there were 6 or 7 people there, he continued to take care of everybody in the room and made sure everybody was understanding what they were doing so they wouldn't learn how to do it wrong. I could not believe that just walking on the carpet in the beginning, I was falling all over myself. And he was expecting us to walk on a beam. And to me, that just seemed like a real challenge. But after practice, I found out that I could not only walk on the beam, but walk without my eyes open. That was huge. And then he put me on a ball. And in order to stand on that ball without it going out from under you, you had to practice. And so that too, I found I was able to overcome, and that just made me feel so good because it seemed so impossible in the beginning. It was because of his encouragement and him showing us how to do everything right. I liked the people that came in because we all encouraged each other. We would call each other on the phone if we were feeling weak in a certain area. He put us on the power plate after we earned that privilege with some of the things that were going on in our system that we needed to take care of first. And he had a prong that he used on our feet so that we could see that how diabetes is so subtle, because we really didn't realize that we were getting numb in certain areas of our body because we just were clueless about that. And it was so interesting to learn how this disease is so subtle and why I had some of the diseases I had. He had us read books, or not read books, but look at books with pictures and try to find pictures that would match, or how many pictures we could find where things were missing. It was challenging at first, but then it became easier because we got used to it. I found out that my left side of my brain was weak and I couldn't remember things. And so he was strengthening that muscle in the brain so that I'd be able to do that again.
And for those watching, all chronic health conditions affect our brain neurologically. And so what Ms. Nichols is referring to, the walking on the carpet and walking on the beam and doing these picture books, that's part of the neurological rehabilitation, right, Ms. Nichols, that we're putting our patients through. So those that are watching, so they can understand what you're saying there. And keep on going. You're doing great.
The diet was not at all what I had dreaded. Dr. King let us be as creative as we wanted to be, where we would be eating twice a day. At least that's when I chose every 2 hours to 2 or 3 hours to eat something that was fulfilling and yet not too much, so that we could control the spike of the sugar in our blood. And Dr. King said he was really impressed with all the menu I had because everything was so tasty. That's why I was staying on it for so long. And after 6 months now, I find I don't even want to get off of it still, and that's just not like me. I need a challenge, and I like a lot of variety, and I'm out there looking all the time. But I feel that this is still a winner with me, and I'm not tired of it, so just stick with it. It's making it so successful for me. Then I started losing the weight, and I got so much attention from everybody. Something I couldn't do for myself for 15 years, I was able to do in 3 months. That was huge for me. I was so grateful. We were on a non-gluten diet, and I love a challenge to go out and look for things, and so I found stores that helped you out, and it was just sort of like you're a detective looking all these different places and discovering all these nuggets to only make you better, and it just built such confidence in me. The other thing I liked about Dr. King was that he was teaching you and training you for your future, how to survive the rest of your life and take control, and to get off all your medications if you possibly could, because you wouldn't need them anymore for all these diseases. They all disappeared. So when I went to my family doctor and had another test taken, he was amazed that I was no longer insulin resistant. As far as the points go, I was way down. My cholesterol, my not progesterone, but my blood pressure, everything was so low that I had never seen it that way before, and I was more impressed than the doctors were. And I kept saying, see, look at this weight, look at this, because they've been trying to get me to do it. But really, it's you who really has to believe. And I felt like $1,000,000. So my hat's off to Dr. King. I highly recommend him for your coach. You can't go wrong.
Well, thank you, Mrs. Nichols. So would you say that those 3 months was worth it?
Absolutely. Hands down, I wish I was still here.
Great investment to make into yourself?
Oh, yes.
Oh, yeah. And Miss Nichols did wonderful. So just to kind of summarize, Miss Nichols came in and she was suffering from type 2 diabetes, correct? And on those follow-up lab tests, like you were saying, the doctors were amazed, you were amazed, and now your blood tests look great, and you're feeling great.
Yes.
One thing she used to tell us is when she would come in, she would tell us that people were noticing the energy that she was having, and you could just see it in her face. And she was always coming in and telling us how her friends were telling her and coming up to her and going, what's different? What's different? What was different? You were just feeling better.
That's right.
That's right. All right.
There's nothing like it.
Any last words for those that might be watching?
The wisest thing you can do is see Dr. King so that you'll get a new lease on life and be successful. It just makes you want to live forever.
Well, thank you very much.